everyone. This is Taylor with MassLive. I'm joined with MassLive reporters Irene Rotundo and Will Ketcher, who recently went out with a group of members in the city of Boston to see firsthand their efforts to provide services to the homeless population in the city. Thank you guys both for joining me. We're going to catch our readers up in case they missed anything or they have yet to read your coverage. So thank you guys for being here.
Thank
Thank
you.
you for having.
Awesome.
Thank you.
So, we're going to start first by setting the scene of the night that you two both went out into Boston. What were some of the things that you first took notice of? Let's paint a picture, of the sights and sounds of the homeless population that you were seeing in the city. Was there anything that struck you? Let's talk about that.
Yeah, I mean, we started out with a big group of city officials. We began at 11:30 p.m. and just went into downtown Boston. So we went around the downtown crossing area, up and down side streets. We poked into every T stop that we passed along the way, and looked into pretty much every doorway, nook and cranny. For me, I think it resonated with me a lot. The amount of people that the volunteers and officials did seem to know. There were people who were happy almost and jovial to be talking to these officials, and generally a lot of these people didn't have a lot on them. Some were in wheelchairs, other people were wrapped up in blankets. Everyone had some form of something to be keeping themselves warm, but it wouldn't be anything the average resident would consider enough.
Yeah, and we were following the Boston homeless census. It's part of a national effort to get a count on how many folks are living on the streets, but also to as Erin mentioned, connect them with services or medical care or shelter or whatever they might need. I think I recall one guy who was mostly set. He was comfortable where he was, but he wanted to know if they had a chocolate bar or just a little snack to get him through the night. Yeah, we spent about 2.5 hours walking around an area of downtown Boston where there, during the day is a lot of activity, businesses, shopping, restaurants. There's a ton going on in downtown Crossing in Government Center where we were, but at night it was cold. It was really sparsely populated, incredibly windy, and we were with a small group, maybe a dozen or 15 folks from various organizations who were just trying to link up with the people who are still out there at 1 in the morning or 2 in the morning, healthcare providers, folks from the Downtown Boston Association, folks from the city. Their goal really was not just to get a count on the population, but to see what they could do for them, whatever that might be.
So you guys talked a little bit about the people you were joined with, officials, volunteers even. Who are these people exactly? How did they get involved into something of this magnitude? What's their role and what do they really provide to the homeless population?
Yeah, there were, as Will said, there were a few healthcare workers who were with us and city workers. A majority, I would say, that we noticed were city employees. There was one man specifically, Jim Green, who has been doing this for 38 out of the 45 years the city's been doing the homeless census. He is the assistant director for the street homelessness initiatives within the mayor's office of housing. And he was definitely someone who just knew what was going on out here. He knew where to be looking. He knew where to go. That wasn't the case for everybody. We met a couple people who said this was their first count that they participated in and helped out with. So it just seemed like a collection of people who, as Jim put it, really, they were putting the right people on the streets, trying to collect people from organizations that could help, be it homeless healthcare. We spoke with a woman named Becky Tachik, who is also a registered nurse, and she's part of that organization and they provide healthcare to homeless people and formerly homeless people. So that's kind of who they were trying to bring together, a band of individuals who could best serve all the needs in the short span of time that they were doing it.
So I noticed one thing that I took notice of in your reporting is that it seems like not everyone who is a part of the homeless population in Boston wants to be helped, or maybe they're, politely declining. What can you say to that? And are there any reasons why that might be?
Yeah, that was something I spoke with Becky Tachik about a lot. Again, with the homeless healthcare homeless center. She she explained that there are a million reasons why someone who's sleeping in the cold wouldn't want to go inside, and that might seem odd to the average resident, average person, but that can vary from mental health reasons, the substance abuse, but then also they're worried that their items that they have, the few items that they possess, might get stolen in the shelter. They're also, some people just don't want to be around that many other people who are suffering, which is exactly what Becky told me as well. So, and then others still too, there's a number of homeless people who were once in prison or incarcerated, and they feel that being in a structured shelter system like that reminds them of that incarcerated time in their life. So there's a million different reasons, and it might not make sense to people, but they're real reasons.
So in your story too, you kind of noted that the rate of homelessness in the greater Boston area has upticked in numbers. Can you speak on some of the reasonings behind this, and how is the city working to combat that?
Yeah, so the homelessness rate has definitely jumped. And so we have to consider, at least with the Boston Indicators report that looked at these reports. There's a report by Boston Indicators that looked at the data from last year's reporting and talked about it before this last count last week. We have to consider that when the timeline of when they are conducting the actual homelessness census, and because that's January every year.
Okay.
And that's done because they want to try and catch the people who are not in the shelters and try and get an actual idea of the actual physical street population. But with that, in January 2024, last year, we had an influx of migrants into Massachusetts who were staying in Boston Logan and who were ending up on the streets with that. And so the Boston Indicators report has attributed that influx and jump in homeless population to the influx of migrants in that time period. And again, this was right after, in January 2024, was right after Massachusetts hit its shelter capacity limit in October 2023. New restrictions took effect later in 2024. So again, this time of reporting period, it does show a different place and data. So, yeah, I guess, and so the full impact of this influx might become a little more clear once this 2025 census data is completed and looked through at the end. Should be by mid 2024, they're hoping. So this influx from last year can be compared with what we saw this year.
Okay, Will and Irene, is there anything else that I might have missed that you guys want to speak to? Anything you want our readers to know, even if it was something that didn't necessarily make it into the reporting, but something you feel the need to share?
I mean, I re-mentioned this gentleman, Jim Green from the city, who I think you said he's assistant director for street homeless initiatives. He said something at the end of the night. You asked him, what he basically how he summed this up, how he felt, at the end of this, and he described it as both heavy and also hopeful. And I think we saw both sides of that. These were people on. This was a really cold night to be outside. Most of the folks who were walking around were double, triple layered, had thermal layers, jackets, hats, all the above. We saw people who had none of that. The two of us were approached just as we were heading home at the end of the night by a woman, I think in a long sleeve or a fleece, no gloves, no hat, no jacket, who was in downtown Boston and trying to get to East Boston, pretty far away at a time when the transit system's not running anymore. People in like the most difficult of conditions. So it was really heavy and, really like a sobering time to be out there. But Jim also mentioned kind of the hope of what we saw. And I think we picked up on that as well. We saw, these outreach workers connecting with people, connecting them with services, convincing someone to accept a ride to a shelter, or even just offering them some food if that's all they were. They said they needed in the moment. We saw the rapport that a lot of them had with the folks on the street. They knew some of them well, and care about their well-being, like, clearly. And so it was heavy, but there were there were reasons to be hopeful. And I think the other thing we saw was just something everyone should keep in mind, whether they're in Boston or Springfield or Worcester or anywhere in the country, is that there's folks on the street everywhere, and they're people like us, and they should be treated with compassion and dignity. If they're in a medical emergency, the right thing to do is to help them. And people, they're out there everywhere. But it was definitely just a good lesson to keep in mind, and I think that's shown through in Irene's story. There are people who are in just these very difficult circumstances, and they deserve our compassion anytime we're out, interacting with them.
One thing I did want to add to, kind of as Will mentioned, Jim Green was speaking about solutions, kind of at the end of the night, and while we had mentioned earlier, migrants and the migrant population is a potential reason for the influx that we saw last year, that's further compounded by affordable housing needs in Boston. The fact that families are not able to access affordable housing or in a sustainable way, and that's due to high housing costs and policy barriers that exist in Massachusetts. So it's part of the solution, as Jim Green had been mentioning, was we need to create and develop and rely on our state and federal partners to help combat this. But a big part of it is also community, and that's what Will said. It means calling 911 if you see someone who's asleep in the cold. And it means donating your money and supporting the initiatives that the city has to help get people off the streets. So I think that's definitely an important thing that Jim wanted to get across. And another thing about Jim, he was a city official, but he cared a lot about this. This is something that's near and dear to his heart. You could tell from him talking about he's getting to go home to sleep in his warm bed at night, and he's upset that there was a man he saw under the influence on the subway who isn't going to be doing that. He will be out all night, and Jim's going to bed worried about that. I think, as Will said, it's about caring about these people, and so it is, at least take solace in the fact that we do have someone like Jim Green and others who are like Jim Green who are doing this work for the city to be looking at this issue in the correct lens.
A lot of people out there. We were on one of, I think, 4 dozen teams roughly that were out across the entire city. A lot of people, spent, they were out there till 2+ in the morning. And people don't do that unless they really care. And so it was very, very impressive to see that.
Absolutely. Well, thank you both for sharing that. And thank you guys for joining me today. You can read more about Irene and Will's time spent, going through the city to learn more about the efforts provided to help people who are homeless on masslive.com. And we will have this interview posted on our social media as well, if you want to look back at that. But thank you all for tuning in, and we are going to sign off.
Thanks, Taylor.